Let's go. So I want to wish everybody a happy new year. Hopefully everyone has a safe, healthy, happy new year. We have a, a better year in 2021 than some aspects of 2020 have been. I also want to thank you all for just the hard work that everyone's been putting in over the past 10 months. It's been a long road, and seems reasonable on this occasion to appreciate one another. With that, I'm gonna share my screen. We don't have a full surveillance report today. Number one, because it's not that day. It's usually on a Friday. But we typically, the last time we did this, we weren't really seeing any significant differences. We are seeing a bit of a difference in the last couple of days, and I wanted to share that data without making too much of it. So just bear with me here while I share my screen and make sure my audio is still working. Y'all see that okay and hear me okay? So what you're seeing here is our daily cases and rolling 7-day average over the course up through December 30th. And you can see we have had an uptick the last few days, but there's a little bit more to that I want to make sure that people are tuned into. So what you see here is on a day-to-day basis, the data behind that graph. And you can see our case count per 100,000, our raw case count, and then the impact that's having on our 7-day average. And I'm sure you all noted on the 29th, we had a pretty significant number of cases. But a significant chunk of those cases were related to a reporting delay that we were seeing in some of the surveillance testing that was happening in Big Sky, that is happening in Big Sky. Not all of those cases were contemporaneous to the week that we're in. And that had somewhat of an artificial impact on our numbers. They're real cases. The good news is those cases were contact traced at the time they were detected by the contact tracing operation that's happening with the Big Sky resorts. They just didn't quite make it through the layers of the reporting chain to make it onto our dashboard until this week. So those people were contacted, that contact tracing happened, but the numbers didn't hit. So that's a little bit artificially high. What you can see here is the numbers when we take out those additional Big Sky cases that came in. Again, we're still seeing a bit of an uptick. We had been down during right around Christmas in the low 30s. That's bumped up a bit, but it hasn't bumped up to the extent that might be thought if you just looked at the raw numbers. So again, there's a lot going on in these numbers. There's also a lot going on with the holidays. I'm sure you all noticed the uptick. We still had over 100 cases on the 29th. That's significant. But again, we're looking at longer term trends, not just what happens in one day. And I think it's important that we don't just look at those 1-day daily numbers. Our hospitalizations are also on a slight uptick, but not in a dramatic way. I think we're back up into the teens, and so we're going to keep a pretty close eye on that. What probably wasn't impacted by the Big Sky numbers is our positivity rate. And we have seen an increase in our positivity rate over the last few days. We've been talking a lot about this. There's probably, again, some stuff going on with the holiday. You would expect over the holiday weekend, a lot of the tests that are run are people who probably were pretty seriously sick. You don't typically go into the doctor over the holidays unless you have something going on. We are seeing a rebound. Again, I don't want to overreact to that. I just wanted to note we are seeing in the recent days a higher positivity rate in the test results that we're seeing. We're just going to watch that. We'll put out a report on Monday that'll again provide some context for that. we are seeing a bit of a rebound in numbers. Frankly, we should expect that coming off of a really significant holiday. And again, we've got another one coming up this weekend that might throw things into flux in different ways. We did that. Oops.
Matt, I think your audio went out.
You hear me now?
Yes.
Yeah, for some reason, when I go back and forth, it messes with my ability to be heard. You can see our positivity rate has increased since the holidays. We're going to just keep an eye on that. It's not worth overreacting to any one day, but it is something we're gonna be watching. The other thing I'm watching pretty closely is the new variant of the virus that's been detected in Colorado and California, I believe. What we know now is it's a variant strain of the virus. We've found it in those two states so far. It may have changed since the last time I read about it. It's not right now, what we're learning about, it's not thought to be more deadly than other versions of the virus, and nor does it seem to cause more serious illness. That's good news. But it does seem to spread more readily, maybe 50% more readily. And if that's the case, if that bears out, even if the individual strain isn't more deadly or cause more serious illness, if it causes the number of cases that we have to increase, it will probably cause an increase in hospitalizations and deaths. So we're really watching that closely. I think that communicating on that is going to be tricky, because there is some good news that the new strain doesn't seem to be causing more hospitalizations or more serious illness. However, if it's causing more cases, that's a greater number of people, and we're likely to see more hospitalizations overall. We also know seems to indicate that masks, physical distancing, and hand hygiene are still the best ways to contain spread. It makes administration of the vaccines all the more urgent. We want to make sure we're getting those out, but we've got a long way to go on that. We've got several months ahead of us before we get anywhere close to a population level of immunity that would stop spread. So we need people to continue that physical distancing, hand hygiene, especially going into the holiday. We need people to continue to be disciplined. And there's no reason to doubt at this point in time that the current vaccines won't be ineffective. It looks like the vaccine is going to continue to be effective with it. Again, it's really worth watching. Any mutations in the virus are a cause for concern. There's some good news and some concerning news. The fact that it might spread more readily, as I've said before, this is a numbers game. The more cases we have, the more hospitalizations that's going to create, and the more deaths that's going to create over time. So anything that increases the overall number of cases through spread is a significant concern for us. We're currently still in phase 1A in Montana, and really in the US in general, but certainly in Gallatin County right now. Again, what that means is recipients are frontline healthcare workers and residents of long-term and assisted living facilities. The initial focus is on those healthcare workers with direct exposure to the virus and to patients. We are at the health department. We're finishing up the administration of the initial 300 doses that we received. I think it was December 23rd. We received those doses. Those are all allocated. It's just a matter of getting them out to healthcare providers in different ways. Bozeman Health told me today they've received so far a total of 2,475 doses. About 70% of those have been administered within their health system. And Community Health Partners, our community health center for Gallatin County and Park County, received 200 doses and has so far administered about 120 of those. So that work is ongoing. We continue to work hard with that, get those vaccines administered when we can. Looking ahead, we expect to, not misspell next, we expect to receive at least 500 doses, and we're hoping up to 1,000 doses next week. We're planning some points of dispensing, still focusing on category 1A. And again, those are frontline healthcare workers. Long-term care facilities are being handled by commercial pharmacies that are operating sort of independent of the effort that I just described to you. But where we are continuing to monitor at the health department, we're paying very close attention and making sure that all of our long-term care facilities are aligned with those providers and getting access to those vaccines. And we're confident that's happening right now. We're in touch with all of them to make sure that none of them are falling through the cracks. And where there is, if there wasn't a situation where one of those facilities was not getting access, we have a direct conduit to DPHHS, but so far that's looking good. I want to emphasize, and I need your help in emphasizing, we're still in 1A distribution. There's not enough vaccine to go around to offer the general public. We're getting a lot of calls, I think is just genuine interest in getting the vaccine. We're happy to see that interest. But right now we are reaching out to healthcare providers in order to draw them in. We don't have enough vaccine to be able to do a situation where anybody can come to those clinics. So we're not going to be sharing a lot of information about those clinics because we don't want to cause confusion. It's not a situation where people can just show up and get a vaccine. We are still reaching out to healthcare providers to bring them in and give vaccines. There's going to be a little bit more of bringing them in to a point of dispensing that'll be set up at the fairgrounds. But again, that's not going to be open to the general public. That's going to be through invitation with the healthcare providers next week. So if you can help us make sure as you report that, make sure people understand that, make sure people know that most people have a significant period of time, maybe a number of months to wait before we have enough vaccine to be able to administer it to them. Again, we expect phase 1A to last for at least the next couple of weeks. The state has put general parameters on that, where they would project a potential graduation into phase 1B, maybe around January 15th is the date that they have said. You know, we're not making those projections locally, but that seems realistic to us at this point in time. But a lot of it's going to depend on vaccine supply. The biggest variable we have here is how much vaccine we can get. We're building the machine to be able to administer the vaccine. But we just don't know exactly how much vaccine we're going to be getting over the course of the next months. If we get enough, we'll be moving into phase 1B, and phase 1B includes a number of categories, pretty big categories. And the state has projected that phase would last for about 2 months from January 15th through March 15th. That does seem reasonable to me, but who knows? It depends on vaccine supply. We're going to move through these phases at the fastest rate we can while being safe and transparent. That phase 1B includes some pretty big categories of people, includes people over the age of 75, individuals residing in congregate care, first responders, teachers and childcare workers, grocery store workers, a host of critical infrastructure employees. And then the state has recommended that we focus on American Indians and people at high risk due to environmental and socioeconomic factors. We're going to be meeting with a stakeholders group early next week. Again, we're still in 1A. We haven't gotten to 1B next yet, but we'll be working with a community stakeholders group to really talk through how we attack phase 1B when we can get to that. We've got some time there, but we're going to be continuing to plan for it pretty proactively. So the other person that's on this call is Patrick Lonergan. Patrick is functioning as our incident commander. Can you still hear me? Okay. Patrick's functioning as our incident commander. Did you have anything you wanted to say, Patrick?
Good afternoon, everybody. I don't have anything specific, but I'm definitely here to answer any questions that people may have.
Great. Is there anybody else I'm forgetting, Whitney, that's on with us today? Okay. So with that, Patrick and I are available for questions to answer anything you may need to ask.
Hey Matt, it's Perrin from the Chronicle. I was wondering if you or maybe Patrick might be better for this, could explain who will be getting the doses that come next week and how and when they'll be distributed.
I can take a whack at it, and Patrick can fill in the gaps. It's healthcare workers, it's frontline healthcare workers is who we're continuing to focus on, and particularly the independent clinics that aren't associated with Bozeman Health. We'll be looking at working with dentists. We'll be working with the various different kinds of therapists, those kinds of folks who are out there. We're working now with those groups to notify them and to set up appointments to be able to vaccinate them. It continues to be that 1A group. Bozeman Health has an allocation for its network, for its health system. Community Health Partners has an allocation for its system. We're trying to fill in the gaps that are around that system to make sure that the healthcare providers that aren't part of those networks are getting vaccine. Patrick, what else do you have to add to that?
You said it pretty good, Matt. Really, it's, it's the full spectrum of all the people that are in primary healthcare out there, not just, the people in the hospital that we typically think of. It's all the outlying clinics. It's people that, the paramedics and folks that operate our ambulances. It's that whole ambulance system that we're getting into now and trying to finish off in the coming weeks.
Other questions?
Hey Matt, there was a reporter who was unable to come, so she emailed some questions. I put them in the chat for you. You've kind of hit on them, but just hoping to make sure that they get answered for her. So yeah, I just threw them in the chat.
So question, I'll just say them out loud, and then are we having problems getting vaccines? Doesn't seem that New York and New Jersey are having any problems. I mean, I don't know. I don't know about New York and New Jersey. I know that everybody wants the vaccine, or everybody wants supply of the vaccine to be able to offer it. I wouldn't say we're having problems. I'm saying we're anxious to get more of the vaccine to be able to administer it. And I would say that the supply of the vaccine is going to be integral to our success in getting it out to people and get it moving through these phases. We'll see. I wouldn't say we're having problems right now. It's a recognition that this is a major logistical endeavor that our country has embarked upon. I'm trying to have patience with the people who are working on it at the national level, the same as I'm asking for patience for people in Gallatin County. So I'm not going to declare problems at this point in time. I'm just going to say we're anxious to see the vaccine. And then the next question is, when is the plan for distribution going to be released? That will include what groups are up next. Well, I think I just shared that, where the state has shared what its 1A, 1B plan is. The slides I just showed you summarize the groups in 1B. There's an awful lot of interpretation and prioritization that needs to happen within those categories. The other thing I would say that I think it's important to understand is that this is going to be a fluid process, and just because we move to 1B doesn't mean we're going to stop giving vaccines to people in 1A. There's going to be a need to continue to give vaccines to healthcare providers. Likewise, when we move to 1C, it's not like we're going to stop giving vaccine to people over the age of 75. And so the volume of people that are going to be eligible for it over time are going to grow. We're working through. The other thing I would say is within those priority groups within 1B, it's not like we're just going to take them one at a time. I mean, there are different groups in there that are going to have different needs. People over the age of 75, those administration challenges and those demands are going to be much different than for first responders, for instance. First responders, they're all fairly mobile. They're fairly tech savvy compared to people who are over the age of 75, who may be less mobile and less tech savvy. And so in many ways, it'll be easier to get to those frontline first responders. And I would imagine people over the age of 75, we're going to be giving shots to those folks for months to come because it's going to be harder to get to them. So it's not like we just do one at a time, but there is some need to categorize and to prioritize within groups of people, groups of groups, if you will, to make sure. So that's where we are right now. We are having our stakeholders group meet next week. As they come out with, as we finalize planning with them, we will share that with you. But again, I would expect we'll adhere pretty closely to the recommendations from the Centers for Disease Control in the state. But there is some interpretation in terms of where the counties are. I don't know, Patrick, you're closer to logistical planning of this. Anything to add to that?
I'm sure I can speak a little bit to the where and the how and the tract, and with the caveat that there's still a fair amount of unknown that we don't quite know yet. But the where, our assumption is that just like we're starting a point of distribution at the fairgrounds to help finish off those phase 1As, that as this grows and becomes less targeted and more of a general populace activity, that we will have multiple points of distribution around the county. We have some plans that we're looking at on where those will be and how best to accomplish that. But we do foresee that there will be multiple sites around the county that we're helping support through the health department. Some of the to be determined that we don't completely know the answer to. It also looks like that some of the primary care providers like the hospital and clinics, some of the pharmacies likely will get approved as providers also, and may very well get allocations to be able to provide vaccine also, in addition to the points of distribution that we're doing. But again, that's not a for sure. It just kind of looks like that might be in the works. So some to be determined on the where. The how they get administered and tracked, and basically the registration is how I interpret that. How do you get signed up? We are incredibly anxious. Next week, we'll be receiving some initial training on a software platform that's used by many states around the country. And Montana has started launching that platform. And that platform is explicitly designed to support mass vaccinations and pod operations. And it's kind of a cloud-based one-stop shop where individuals can go in, they can see where their places are that they can get vaccines, they can see the available time slots, they can register, fill out all the paperwork online that needs to be done, the disclaimers and all that medical stuff. And then that system reminds them, provides reminders for them, it schedules their second follow-up shot for them. And then when they show up for us, it's seamless on our side for the pod operations, where they just check them in on a computer or a smart device. They track what medication they got, and they do all the follow-up information electronically. So that's kind of the who, how, and where that we see that heading for the administration of vaccines in the coming months. Still some to be determined on pieces of that, and some of it's we haven't gotten our hands on it yet, but we have great faith in that software based on other states' success with it.
I think it's really important that people, the general public, understand that for most people who are not of advanced age, people who are not in these sensitive occupations, we've got a pretty long wait ahead of us. There's going to be several months, and most people are going to be waiting until late winter or early spring, at least, until we have enough vaccine. We're trying to vaccinate a world right now, and that's a huge challenge. And so I just want people to understand we need patience. We need people to understand that we need them to bear down on some of the things that have helped save lives, frankly, over the course of the past few months. Maintaining that social distancing, continuing to wear face coverings, staying home when you're sick, washing your hands frequently. We need to keep doing that stuff. I hate to keep harping on it, but it's really important. I know that there's some optimism related to these vaccines. There's a lot of attention regarding these vaccines, but we have a pretty long path ahead of us, and that's a huge logistical challenge. Other questions?
I have a question, Matt. We have a new administration starting in Helena on Monday. and Governor-elect Gianforte has alluded to removing Montana's mask mandate and any restrictions as to operating capacity at restaurants and other public gathering places. Does this concern you as a health officer?
Yeah, I mean, first of all, I would congratulate Governor-elect Gianforte. And as we have a new governor take office, I think it's important that we all respect his responsibility and his authority to govern and address the pandemic. And at the local level, we intend to respect him and his work, and we'll do everything we can to work with the new administration. Likewise, I fully expect the new governor will recognize and respect the duty of local boards of health that they have under state law to prevent the spread of communicable disease and make decisions at the local level, including through emergency rule. The governor has the authority to modify statewide directives, but emergency rules passed by local boards of health, such as the ones we have in Gallatin County, will still remain in effect. And so in Gallatin, that means people will still be required to wear face coverings in most indoor public spaces. That means the restrictions that we have on business operations that are intended to reduce the transmission of the disease will still remain in place. The face covering rule is in effect until at least January 20th. With the new variant of the virus, with the return of Montana State University, I anticipate recommending the board to extend that rule for an additional period of time. That face covering rule is a pretty landmark way for us to reduce transmission, especially when we're seeing a more potentially a more transmissible form of the virus. Now, I hope the governor retains the current directive on face coverings, especially with that new, more contagious virus circulating in the US. That new strain combined with less mask wearing could be a dangerous mix for Montanans. The business restrictions, we're going to watch the epidemiology. Those restrictions on business operations are through February 5th. Or early February. We take very seriously not to keep those in place for one day longer than we need to. So we're going to be really looking at the epidemiology of that and having the board make decisions based on what the epidemiology. We've got some stuff coming at us though that could change things pretty dramatically. We've got that new variant strain. We've got to watch how that affects us. And we've got thousands of MSU students coming back into town, and we're not yet into the height of ski season. So that is going to create some issues too. So we're going to be watching the epidemiology. I would say that in state law, local boards of health have a significant duty to take measures. That duty and that authority rests at the local level in the state of Montana. So we're going to respect and work with the governor, and I'm sure he'll respect and work with us. Other questions?
Yeah. Hey, Matt, and hi, Patrick. Oh, there you are. Mira from Explore Big Sky. I had a question about, aside from the blip or the delay on the 29th, are you finding that the county is getting test results from the Big Sky Relief Program surveillance testing pretty reliably? I know there was a problem over the summer.
The communication has been really good. I mean, we have a direct line. Bozeman Health has a big stake in that, and we talked to the person at Bozeman Health who's running that multiple times a week. So I'm really not concerned about that communication. What we really have seen is a delay in the case numbers making it to the MIDAS system where it hits our dashboard. The other thing to understand about the Big Sky surveillance is that that group that funds that testing has also funded contact tracers that are trained by us, and we work with them. But those contact tracers are working sort of autonomously within that organization. So that contact tracing is happening. So as long as that contact tracing is happening, as long as we continue to have that communication, that is what we're most concerned about, and that has been happening. I would also say, Mira, what we're seeing in those surveillance numbers are pretty are pretty reasonable positivity rates. We're seeing positivity rates well under 5%. That's good news. So, I think the fact that testing is happening, that it's sustaining itself, it isn't sapping the rest of the county's testing system. Those are the things that we were concerned about, and those things seem to be happening right now. Other questions? Okay, I wish everyone a happy new year. Stay safe out there in a variety of ways. I want to urge everybody to maybe keep your group smaller over this evening and moving into the new year, and just continue to bear down on those things that we know disrupt transmission. Have a great new year.